Now, what about the people who have written in and say that they have hernias? What would you say to them? Are they supposed to do the same kind of exercises? Is this a related problem?
Hernia comes from exactly the same cause problem, and that is pressure. Okay, it's a pressure-related issue, and so all of those alignment issues I talked about and the finding the transverse, all of that will certainly help in reversing the pressure that is causing the problem. But a hernia, the difference between a hernia and a diastasis is a weakened, stretched midline of connective tissue. A hernia is when something's actually come through. Okay, there's a hole in the abdominal wall. The most common for moms is an umbilical hernia. So at the umbilicus, it's literally the weakest point. It's that central weakest point, and that's where there's a problem. So you may exercise can't fix the hole. Okay, it's not gonna literally fix the hole, but what it can do is reverse the pressure to make it not a problem. Whether or not you want to have surgery to fix a hernia is an entirely personal thing that needs to be discussed with a doctor as to whether it's causing a problem, whether it's causing pain or an issue for you, and that may be aesthetics as well. So you can reverse the pressure, you can make a change. The same as for prolapse. Again, it's a related issue. These are pressure-related problems. I'm not saying for a minute buy my program and you can fix a prolapse. Everything will just go back into place. And any program that promises it can fix everybody and everything is misleading anyway. In my view, it's kind of what you can do is you can improve it. You can improve tone and strength of the muscles that stabilize you, and you can try to reverse that pressure. But if you suspect you have a hernia, then that is something that you should discuss with a doctor.
Okay. What about the people who have just a huge gap and are saying, do I need surgery to fix this? Is there any hope for me to fix it without surgery? Mm-hmm. They've had doctors say you can't fix it without surgery. Is there any point where you can get to that, the exercises just aren't going to help?
I think that, for a start, a surgeon is always going to say that surgery is the best option because that's what surgeons do. But having said that, again, coming back to like I just said, I think to suggest that everything can always be fixed is crazy and misleading. Yes, there will be cases where that connective tissue is so far stretched, so far weakened, so far disconnected, that exercise is not going to bring it back, that connection cannot be re-established. My view on that would be that it can always be improved, you can always help, and you can do an awful lot before you get to that point. But I do believe that in some cases, if the only way to pull those two muscles back together again is surgery, then so be it. It's rare that that's the situation, and I've never actually come across anybody that's sort of come through me that's sort of eventually gone, you know what, I'm just going to go and sew it up. The other thing to remember there too is so long as you can improve it and improve that stability and strength, remember a small gap may not be a problem. It may not need sewing up.
Okay. One last question that I had is some of the programs teach you to wrap a towel around, to kind of help pull muscles back together as you're doing certain exercises, or possibly wearing a splint. I know I wore a splint for a little bit after I had my C-sections, mm-hmm. just for some stability. But as part of an exercise program, is that something that I should go back to, wearing a splint, or, does that help or does that hurt? I don't know.
My programs, I don't use splinting at all. The reason I don't use splinting at all is because I want to reconnect the woman's mind to her muscles, and for that to do the job, for the body itself to do the work. The danger with using something, especially something that's worn all the time or used constantly, is that splint, that binder, that towel, whatever, starts to do the job kind of for you, and it becomes reliant. One becomes reliant on it. I think it's important to note too. I mean, the other programs that use this as well, you know, referring probably to Tupler is the most sort of well-known one as well. The Tupler technique is something that has been very specifically designed to fix a diastasis. That's what it does, and it's very focused on that one muscular issue. Where my programs, my methods, if you like, differ, you know, I have a huge amount of respect for every other professional in this field. We're all trying to fix the same problem. We're trying to put women back together again, you know. So this isn't about criticising other programs, but simply to kind of explain that, you know, where I'm coming from, which is I address the postpartum woman's body, however postpartum she might be, as a whole body issue, and that's what my programs do. So I don't like to use too much in the way of splinting or binding. I think what it can also do is kind of have this, what I call the tube of toothpaste effect, in that, again, coming back to that, just displacing pressure up and down. If the muscle isn't engaging really correctly underneath all that, then again, all you're doing is shifting stuff around. So it's, as I don't use them, I like the body to do the job. But that's sort of where we're coming from. MUTU is a whole body program, and with restoring core and pelvic floor as its foundation, and narrowing a diastasis is kind of a nice byproduct of that.
Okay, that makes sense. So where do we go from here? I want to fix my core issues. I want to have a strong core. I want to have a strong back. I want to be able to do whatever kind of workout I want to do without getting hurt. And I know everybody that, you know, the reason that this post has become so popular is because there are a lot of moms out there that are looking for, okay, what's this next step? So what would you recommend that we do now that we have kind of some better information? What would you tell us to do?
I would say the first stage is to think about what I was talking about the root problem. The root cause of these issues is this pressure and alignment thing. And that's where I would say has to be the starting point, because you will simply get frustrated when things don't work out. If we don't address the way that the pressure is being exerted in the first place, we're not going to fix the problem. So it's about thinking through those alignment tips, and I'll put these up for you know, in sort of bullet point form as well. But it's untucking your butt. It is breathing correctly in the ribs. It's not sucking in. It's breathing, walking, sitting and turning in a way that doesn't continue to increase that pressure. So it's addressing the root cause, and on top of that, it's thinking about that connection and that core engagement. Find your transverse muscle, focus on it, visualize it, connect with it, learn to love it again. We can't fix what we don't like and what we're not talking to, and unfortunately many moms do not like everything below there right now. It doesn't look like it used to, it doesn't feel like it used to, and we cut off, and that for me, I think is a big part of the problem. So it's learn about it, understand it, find it, and then when you've found it, you can start using it in everyday movements. And those further workouts, they'll come, you can do them. You just need to get a strong core before you get there. Okay.
Well, I really appreciate you taking time to talk to us and you know, kind of cut through some of the misconceptions, and I'm excited to kind of get back into it and make the commitment this time. So I will be putting out some resources, some of your links, and anything else that you have for us for people to find. And
sure.
I just really appreciate you helping us out.
Not at all. Thank you very much for having me.
Thank you.